Hi, my name is Erin Taylor, and the title of this poster is Endothelin Receptor Antagonism Improves Adipose Tissue Inflammation and Glucose Tolerance in an Experimental Model of Autoimmune Disease. SLE is a multi-system autoimmune disorder that primarily affects women of childbearing age. SLE patients have a variety of problems, including renal injury and inflammation, elevated blood pressure, and increased cardiovascular disease risk. Patients with SLE are also more likely to be overweight or obese and exhibit characteristics of metabolic syndrome. Patients with SLE also have elevated endothelin 1 levels, and these levels correlate with increased disease activity and renal involvement in lupus. However, the role of elevated endothelin 1 in the development of obesity and insulin resistance in SLE is unclear. And we hypothesize that endothelin receptor antagonism will improve metabolic parameters in a rodent model of SLE. To test this hypothesis, we treated control in SLE mice with either vehicle atrasentan, an endothelin receptor A antagonist, or bosentan, a dual antagonist of the endothelin A and endothelin B receptors. It is important to note that similar to patients with SLE, this mouse model also develops obesity and insulin resistance. So we treated the mice for 4 weeks, and at the conclusion of the study, we performed glucose tolerance tests and collected tissues for further analysis. We also assess body weight and body composition weekly. And as you can see in figure 1, SLE mice consistently weigh more than control animals, and treatment with a dual antagonist lowered body weight compared to SLE vehicle treated animals. In figure 2, you can see the results of the glucose tolerance test. There are no significant differences in fasting blood glucose among any of the treatment groups, but vehicle treated SLE mice have elevated fasting insulin as compared to all the other groups, and both atrasentan and bosentan treatment significantly lowered fasting insulin in SLE mice. You can see in figure 2C, SLE mice in general have impaired glucose tolerance compared to the control animals, and treatment with either atrasentan or bosentan improved glucose tolerance, which you can see in figure 2E and in the lowered area under the curve calculations in 2F in the SLE atrasentan and SLE bosentan. Finally, we also analyzed the effect of endothelin 1 receptor antagonism on adipose tissue inflammation using flow cytometric analyses, and we used visceral adipose tissue that we got from the mice. When we examine the relative percentage of total macrophages, there's a decrease in SLE mice as compared to the control animals, regardless of the treatment group. There's also a decrease in eosinophils. These cells are generally thought to be important in the control of obesity-associated inflammation, and neither atrasentan nor bosentan had any effect on these cells. As shown in figures 3C and 3D, SLE mice had an increase in CD4 and CD8 T cells as compared to the control animals. But treatment with atrasentan significantly decreased CD4 T cells, and bosentan treatment significantly decreased CD8 positive T cells. So in conclusion, endothelin receptor antagonism, it seems to have positive effects on body weight and glucose tolerance, and adipose tissue inflammation, specifically T cells in a rodent model of lupus. And thus blockade of endothelin 1 receptors, it may be beneficial to patients with SLE to improve obesity and glucose handling. It also leads to some unanswered questions because we found differential effects with either the ETA or a dual receptor antagonist. Okay, thank you for listening.